So good day, ma'am. I am Miles Salazar from BSN 212B, Group 8, and I am going to perform Leopold's maneuver. So it is a systematic palpation of the abdomen for assessing the fetal position and presentation of the fetus in the uterus. So first, I am going to wash my hands to deter the spread of microorganisms and prepare the needed material for me to save time and effort. So here are the materials such as pillow and towel and stethoscope. Next is I'm going to explain the procedure to the patient to gain patient's cooperation. So good day, ma'am. I am Miles Salazar, your student nurse for today. I am going to be your aide. So in order for me to verify your identity, ma'am, kindly state your name and your birth date.
I'm Veronica Styles and January 2, 1992.
So okay, Veronica. So what language would you comfortable to be speak with?
English, yes.
English. Okay. So ma'am, I'm going to perform Leopold's maneuver. So I'm going to touch your belly in order to assess your fetus in your stomach. Would that be fine, ma'am?
Yes.
Okay. Next is let the patient empty her bladder before the procedure. So because distended bladder may slightly deviate the uterus and provide patients comfort and privacy by adjusting room temperature and closing the door and curtains. So next, I will position the client on supine with one pillow under her head and knees slightly flexed to facilitate accurate assessment, and flex knees to relieve tension of abdomen musculature, and place rolled towel under patient's right hip to prevent supine hypotensive syndrome. So ma'am, I'm going to assist you now to lie down. Kindly put your head here, ma'am. And I will going to put towel under your right hip. Okay. And the knees are slightly flexed, ma'am. Slightly flexed lang. Okay. If right-handed, stands at woman's right facing the patient to easily grasp the symphysis pubis during the third maneuver. So for the first maneuver or fundal grip, so it is the face the patient and palpate the uterine fundus to determine the fetus lies in the upper part of the uterus to determine whether it is head or buttocks. So head feels hard and round and movable, and if it is breech, it feels nodular. Okay, for the second maneuver or umbilical grip, so palpates downward direction on the sides of the abdomen by applying gentle but deep pressure to determine the position of the fetal back and extremities. So upon doing this procedure, palpate the other side, and the other side of your hand remains stationary. Do it on the other side. Okay. So for the next or the third maneuver or the pelvic grip, to determine the degree of engagement. So place your one hand in the symphysis pubis and grasp the lower between thumb and the finger like this to feel the presenting part. So the head is in the inlet or in the pelvis. So zero station if presenting part is still movable, hence it is not yet engaged. Okay. So for the fourth maneuver or the pelvic grip, turns face on the client's feet to confirm the findings and determine the flexion of the vertex into the pelvis. So move fingers from both sides from fundus to the pubis. Okay. So next is locate again for the fetal back that we did in umbilical grip. of the fetus to auscultate the FHT for 1 minute using a stethoscope. So normal FHT is around about 120 to 160 beats per minute. Diba? Mag-auscultate ka, ma'am. So assuming that was 1 minute. So next is note the location, rate, and character of the FHT in the cephalic. So it can be heard in either left or right lower quadrant. Then make the patient comfortable to promote relaxation. So ma'am, we are done now. You can stand up now, ma'am. We assist you, ma'am. So how are you feeling today, ma'am?
I feel very alright.
Alright, so do you have any concerns or clarifications?
No.
None. Next is document the observation made and the fetal presentation, position, attitude, and degree of engagement to promote the database for future findings. So here are the findings, ma'am. The fetal presentation is in vertex. The fetal heart tone is 120 over 160 BPM. The position is in right occiput anterior. And the fetal attitude is flexed. And the fetus is not yet engaged. So now we are done, ma'am. So that's all for today.